Welcome to our continuing podcast at Coast Spine and Sports Medicine. Today I'm going to talk about one of my favorite forms of treatment, which we found to be very effective for our patients, which is high-intensity laser therapy. I use laser therapy as a surgeon, initially in doing actually arthroscopic surgeries of the knee and doing laser meniscectomy and debridements, and I've used it also in laser-assisted spine surgery. But then we became interested in using it in a clinical setting, which is an office setting, to use lasers to help patients with their pain. As you know, lasers are widely used in other fields of medicine. Plastic surgeons use it in facial rejuvenation, vascular surgeons in treating venous varicosities. It is used in other surgical fields with success. Traditionally, laser surgery has been used by chiropractors, physical therapists, and athletic trainers in treating injured individuals or athletes. Frequently, they use what's called low-intensity laser, which is 0.5 watt or lower. These don't produce high heat levels, and that's why they're referred to as also cold laser. We prefer the high-intensity laser treatment because it is a far greater level of heat and much deeper penetration. As far as in a 1064 nanometer YAG laser, it penetrates 10 centimeters below. So you can imagine with 10 centimeter distance in a knee or shoulder joint, it's penetrating deep into tissues, not only the skin, subcutaneous tissues, muscles, tendon, bone. Lasers have a positive effect, cell regeneration and growth. The process is termed photomodulation. It's delivering sourced high energy light to the injured tissue. The laser will produce an effect called vasodilation, or widening of the vessels. You can imagine if the vessel widens, there's increased circulation and blood flow to the tissues, to the lymphatics. Lymphatics clear of harmful substances in the body. It can reduce inflammation, reduce pain. It has a direct effect on the nerve endings, so it desensitizes the nerves and can have an immediate effect in reducing pain. In a surgical setting, it can help soften the scar and reduce the pain. The photomodulation is delivered through very short pulses with high repetition rate in the area that's treated. This directly goes to the cells, improves tissue oxygenation because of the increased blood flow. This results a direct effect on the mitochondria, which are elements in a cell. The mitochondria then produce ATP. ATP is an enzyme which helps restore and improve muscle function, nerve function. Also, ATP is important in increasing the synthesis of RNA and DNA, which are the important building blocks of a cell. Therefore, it has a regenerative potential. When I looked at the scientific value, I saw that many of the features that it would produce are very similar to PRP injection, which if you think of a PRP or platelet-rich plasma, it's a blood product, and yet we're delivering very similar benefits without an injection, without a blood draw, directly to the area of injury. And it is shown to be highly effective in our patients. We've certainly had many happy patients. Looking at the literature, it's noted that there are published articles really worldwide regarding high-intensity laser therapy, indicating that it is used not only in the US, but widely internationally. I'll refer to some scientific articles. For example, there is an article in the Journal of Clinical Medicine published in February 2023. It's entitled High-Intensity Laser Therapy for Musculoskeletal Disorders, a Systemic Review and Analysis. And what these individuals did is they looked at 48 different randomized control studies. So these were studies that would control placebo versus that, and 48 studies. And they found that high-intensity laser therapy was superior to other physical modalities, such as a TENS unit, ultrasound, shockwave therapy. It was very effective in reducing pain and improving range of motion of the area. They found it most effective at the studies they looked, especially for shoulder and knee pain. And in fact, the CDC, which is Center for Disease Control, has recommended the use of laser as a form of treatment of chronic pain, acute pain, and even post-surgical pain. And the American Academy of Orthopedic Surgery has recommended laser therapy for treatment of knee osteoarthritis, which is a common condition we treat, knee arthritis. It can be very effective. Looking at other scientific articles, I can point to a physiotherapy article published in December of 2023. They looked at again, a meta-analysis, multiple studies looking at the use of high-intensity laser in the treatment of neck pain, and they found uniformly that there was data showing reduction of pain and improvement of range of motion of the neck with repetitive laser treatments. We look at another study published in Journal of Rheumatology in 2022, which looked at treatment of knee osteoarthritis, again with other modalities, and found that laser therapy was highly effective in reducing pain. They pointed to the fact that the laser therapy improved tissue metabolism, circulation, it removed the inflammatory substances, helped reduce knee swelling. Again, what we talked about is improves mitochondrial oxidation and has a regenerative potential effect. Another study published in 2009 looked at shoulder and compared laser therapy with ultrasound treatments versus doing high-intensity laser, and found that laser therapy was superior in results. Therefore, there are multitude of scientific studies that show its benefit. Certainly, our clinical experience over 7 or 8 years that we've offered this are patients that there's general satisfaction. We usually offer 3 treatments and then increase the number if the person is satisfied. Different body parts are treated. We treat neck pain, back pain, shoulder, knee pain, and other areas can be treated successfully. So it's something that we offer and found it highly effective. There's definitely scientific evidence that shows it is very effective. Sometimes we find patients may be afraid of injections, either steroids or even PRP injection, but this is a way to treat the pain and reduce pain and cause regeneration, healing without an injection indirectly. These are very comfortable. Because it's a high-intensity laser, there's some increased heat in the area. We warn that there may be some blistering, although we've never encountered this. And there are some certain contraindications. Obviously, you can't do it in a pregnant patient, or if they have cancer, bleeding disorders, they have a pacemaker. These are exclusions that we don't offer it, or if you have a tattoo in the area of treatment. But most patients qualify for this, and we find it a very valuable treatment. It's not a standalone treatment, but usually combined with physical therapy, chiropractic, sometimes medications and other modalities to help reduce your neck pain, back pain, knee pain, shoulder pain.